uh, Dr. Vishnu, if you see, this lung has got extensive fibrotic changes,
Yes.
These are called reticonodular changes. And this kind of changes, if you find late onset, this could be post-COVID sequelae. Usually these are post-COVID sequelae, and these are very organized fibrosis, you see. So when you have such a bad fibrosis in the lesions, and she's 89-year-old, huh? So you can imagine there is something a load versus capacity.
Yes.
The lung goes into a kind of, decompensation. Now what you see is that what we are trying to do is and when she came, just show her ABG. ABG is, PCO2 is 7.2 and carbon dioxide 69. So remember, whenever you have a fibrosis of the lungs and patient comes with type 2 failure, usually there is end stage lung. Because normally in lung fibrosis, people try to keep a PCO2 low because they are hypocapnic. So when you have hypercapnia in lung fibrosis, usually it goes into something like a progressive lung disease, what you call end stage lung disease sometimes. So remember, type 2 failure in a lung fibrosis, in a COPD, this still may be reversible. But in a lung fibrosis, when you have a type 2 failure in respiratory acidosis, you have to treat aggressively. It is something like, you had the other patient which you came with a lung fibrosis. Gaurav's mother, Arora. So here you see that what you have done is that you have put an NIV, start steroids, give injectables, and most important is that usually she's diabetic. So when you put all those steroids and everything, they may worsen their glycemic. So give an insulin drip around the clock, around 6 to 8 units per hour. So you have to treat aggressively. Your main target is you have to decrease the workout breathing, number one target. And you can decrease the workout breathing by giving non-invasive ventilation. So here, as I always teach you, that you have to use the optimum IPAP and EPAP to improve oxygenation and ventilation. So 20 by 12 you start, get all the investigation, and usually what happens at this age, when you have this kind of failure, usually they have a heart load also. Get a pro-BNP done, get an echo done, and it's better to give them a decongestive measure, some Lasix or something like that. So treat on the lines of end stage lung fibrosis, and NIV, don't remove it, fix it up. If we need to give her nutrition, we'll give parenterally. Because moment you disconnect the NIV, again she can short up her PCO2. So full face mask, NIV, see to it, she brings her carbon dioxide better, improves her oxygenation, and through NIV and the side port, either you give through the side port oxygenation, it's preferably put a side port.
Okay.
Or if you give through nasal prong, there may be leakage. You see, we have to keep, like now you see, she's maintaining 90% oxygenation, you see? Huh? So 90% is fairly, let's see, let's try to achieve the maximum oxygenation, and after 1 hour, we'll repeat the ABG. We want 10 millimeter drop in 1 or 2 hours, and you WhatsApp the ABG to me. Okay? So this is going to upload for you. Huh?